So the early warning signs of cancer, what do we look out for? What makes us think, oh, just a minute, I better go and see the doctor about that? Let's run through that now. So let's go here. Cancer early warning signs is what we're looking at, because we want to catch this as early as we possibly can. Now, these notes here are actually from my book, which I've put the links there. You can make a free download of that. Any unexplained bleeding. So hematuria is blood in the urine. Blood in the urine is always abnormal. The normal amount of blood in the urine is 0. There's not supposed to be any blood in the urine. So any blood in the urine is always abnormal. The only exception is during periods, when there can be blood contamination in the urine. The blood there is coming from the vagina, not from the urethra. And what we must do then is not assume that bleeding is caused by the menstrual period. What we do is we check again in 2 weeks' time, and if the woman is still positive for blood, then we would investigate that. Of course, the vast majority of times they'll become negative because periods can contaminate the urine, but it's not assuming that that's the case. Blood in the urine is always abnormal, frank and occult. Now, these are terms that we come across quite a bit. Frank blood means it's obvious. Frankly, this is blood. It's obvious to anyone looking at it. Looks like blood, smells like blood. It's blood. Occult blood is hidden blood. So blood might be there in very small amounts. So you could have blood in the urine and not be able to detect it without putting a dipstick in. Or sometimes blood can be changed. So, for example, if someone vomits blood up, it can be like coffee grounds, and it can have an altered appearance. So remember, blood can be frank, occult, or changed. Suspect blood. At any time you do suspect blood, it's a very simple matter for nurses and doctors to test. So hematemesis is vomiting blood. Again, that is abnormal. Now, of course, sometimes with severe vomiting, there could be a tear, for example, in the lower part of the esophagus or the stomach, which is not a cancer. But if there's blood in vomit, that's not normal. Again, get it checked. Blood in sputum is always abnormal. Main causes of that globally are tuberculosis and lung cancer. So blood is not supposed to be in sputum. Again, if it's there, get it checked. Melena is blood from in the stools. Now, blood in the stools is typically we describe it typically as being dark and tarry. It depends where it came from. If it's coming from the lower part near the anus and the rectum, it can be frank blood. Sometimes if you get a pile, for example, it can be very obvious blood that's present when you clean yourself at the toilet. But again, we can't really assume this is from a pile. There's a possibility that it's from a higher up lesion. But if you're bleeding from the mouth, the esophagus, the stomach, the upper part of the gastrointestinal tract into the gut, then it goes through the digestive system. It gets partly digested, and it comes out as this dark, tarry sort of a stool, characteristic smell when you get used to smelling it. So dark, tarry stools we call melena. It's a form of altered blood. Again, consider the possibility that this is leaking. This blood is bleeding out from some form of tumour. Most times we expect it won't be, but it's worth checking out, especially if it's persistent and happens more than once. Again, it can be frank or occult. PV, pervaginal bleeding, so between periods, after sex, it's abnormal, and bleeding after the menopause is abnormal. Even if it's only a little bit of blood, you're not supposed to bleed between periods, you're not supposed to bleed after the menopause, you're not supposed to bleed after sex. And if it is blood, take it further. If it's not blood, you can be reassured that it's not blood. Persistent bleeding from the nose, another possibility. So we shouldn't be picking our noses, but persistent bleeding from the nose or bleeding that's not explained from the nose, again, check out the possibility that it could be something abnormal. It could be a pre-malignant polyp. This is what often happens in the colon. So in people over the age of 60, I think in the UK now, we do annual or biannual checks to see if there's occult blood in the stool, just to see if there's a little bit of blood there, because that would be an abnormal finding. Very often it might be a polyp, but polyps can become malignant. Bruising, of course, is just bleeding into the tissue. So all the bruising is bleeding from the capillaries and the small blood vessels. That's all it is, and you get this bruise. It goes, it's dark to begin with, kind of black and blue, and then it goes a bit yellow as it starts to clear as the blood is broken down. But again, remember, bruising is just a form of bleeding. Now, discharges. When we're talking about discharges, we're normally talking about pus and pussy things like that. Well, it could be a serous discharge, it could be a clearer discharge. Now, discharges normally mean infection. But the thing about malignancy, if there's a tumour growing somewhere, whether it's a breast duct or in a respiratory passage, it alters the architecture of that structure and it can't clear its mucus and clear itself as it normally would. So infections become more likely. Infections are associated sometimes with discharge. So certainly want to check out, indicate infection, but tumours distort and block normal anatomy. That's the key point. So repeated chest infections, chronic cough, long-term cough should be checked out. Pus from the urethra should also be checked out, although normally it would be an infection. And pus from the nipple. Now this most commonly, of course, this occurs in women, but it can also occur in men. There can still be bleeding from the nipple or discharge from the nipple in men, and again, it's an abnormal finding. And of course, we mentioned the vagina. Changes in bowel habits or bowel activity is another classic feature. Changes in defecation, that's just pooing, frequency, consistency of the feces, constipation, diarrhea, for example, the shape, if the stool is a different shape, the colour, or if there's mucus associated with the shape. All of those can be abnormal. Again, normally, of course, not caused by cancers, but doctors can check this out really quite simply without too much difficulty. Colour, dark or pale. Now, obviously, if the stool is dark, that can be melena, that can be blood. But if stools become a very light colour, a clayey type colour, that can mean the bile's not getting into them, because it's the bile that colours and deodorises the faeces. And if the pancreas, if there's a tumour growing in the pancreas, that can block the bile ducts. Many other causes, of course, but pale stools are always worth getting checked out. And again, a few simple blood tests can normally give you the diagnosis. Floaty stools could mean there's a lot of fat in them. And again, that could mean that the pancreatic digestive enzymes are not getting through to digest the fat. So floaty stools are abnormal. Dark urine can mean that the bile's not getting into the gut and can go into the urine. So dark urine again can be a symptom of pancreatic cancer. Abnormal bloating or swelling of the abdomen, again, is not normal, that should be checked. Persistent heartburn or indigestion. Now, some people get heartburn and indigestion for years. I mean, I have to take lansoprazole tablets myself sometimes just for a bit of esophageal regurgitation. But if it's new or it's changing, it could be a cancer in the esophagus or in the top of the stomach, the fundus of the stomach would be the most likely. And we can't emphasise enough that you can be reassured in the vast majority of occasions with just a few very simple checks that nurses and doctors do absolutely routinely. Changes in bladder emptying habits. This stands for lower urinary tract symptoms. But it can be malignant conditions as well. So it's things like frequency of urination, difficulty initiating urination, desire to urinate frequently, not urinating with a full stream, just dribbling a bit. These are lower urinary tract symptoms and again should be diagnosed. And very often that can be done with very simple tests. Again, sophisticated tests aren't usually needed. Again, it has to be stressed that most lumps are not cancer. There's many what we will call benign causes of lumps, and most times it will be that, but the odd time it will be a cancer. Typically, cancerous lumps feel hard. Typically, they're well fixed in the tissue. They're hard to move between finger and thumb. Typically, benign lumps or benign tumours can be moved between finger and thumb like a cyst, and typically they're not as hard as malignant tumours, but that's not for you to decide. If there's a lump, get someone to feel it who does this day in, day out, and can tell the difference by palpation, or if necessary, can arrange a biopsy to have that properly diagnosed. Again, very simple things that can be life-saving. So breast, testicular cancers, of course, could present in this way. Very often with testicular cancer, the first symptom is not that you feel pain, but one testes becomes heavier than the other. Best time to examine the testes, of course, is after a hot bath. And if one is descending more than the other, again, possible abnormality, get it checked out. Testicular cancer is most common in young men, late 20s, early 30s. Breast palpation, breast awareness, of course, this is fairly widely known. Self-breast examination, breast awareness. Swollen lymph nodes. Lymph nodes can be in different places, under the armpits, for example, in the groin at the top of the legs, and under the mandible, in the neck. If these are swollen, again, it's not normal. If a lymph node is swollen and painful, very often that's infection. But again, it's not really for you to decide. This is what we have doctors for. Basal cell carcinoma, what we call rodent ulcers, non-melanoma skin cancers. These are all fairly obvious on the surface of the skin. But again, don't assume it's something relatively benign. Get it checked out. A new mole or changes to a mole are classic. So if you have a mole where you didn't have a mole before, or the mole's got bigger, or it's changed in colour, or it's changed in shape, or it's a bit higher than it used to be, or it's a bit lower than it used to be, if it's changed, get it checked out. Again, mouth or tongue ulcer that lasts for more than 3 weeks, again, get that checked out, go to your dentist, that's what they're trained to do. Obvious changes in a wart or a mole. Now, this is quite useful. Has it become asymmetric? Is it different on both sides? Have the borders become irregular? Has the colour changed, especially as it got darker, but not necessarily so? Is there changes in pigmentation? Is there variable pigmentation over the mole? Is it greater than 6 millimeters in diameter, or is it increasing in size? A, B, C, D, E. And E is for elevation. Is there bits that are higher and bits that are lower in it? Now, metastases is meta to change, stasis, place. So metastasis is when a malignant tumour spreads from the primary site where it originated to other parts of the body. And once it's in other parts of the body, it becomes remarkably difficult to treat. And the thing about malignant melanoma is it can look like a relatively small lesion, but have already metastasized. So we need to catch these very, very early. As soon as there is a change, get that checked. Ingestion difficulties or swallowing difficulties. Feeling of pressure in the throat or chest, again, lung cancer, esophageal cancers can do this. Difficulty in swallowing, that's dysphagia. That can be cancer in the esophagus or fundus of the stomach, or other structures in the neck, or indeed potentially diaphragm. Night sweats or fever. If you are getting wet overnight because you're sweating, that's not normal. Get that checked out. That can be a symptom of various malignancies. It's often what we call a paraneoplastic effect. It's what goes alongside a cancer, but certainly, of course, it probably will be infection or menopause or other things like that, but don't you make the diagnosis yourself. That's the point. This is a possible feature of malignancy. Undue fatigue, if you're tired all the time. Again, many possible causes. Unexplained weight loss. If you're on a diet, you would lose weight. Unexplained weight loss could be something like developing diabetes. Or unexplained weight loss could be cancer, because cancer increases the metabolism. That's why people lose weight with cancer and they get this cachexia, this extreme weight loss that can occur with cancer. So unexplained aches or pains, especially if they're persistent. And this is a general principle. If something's going on for a long time, if it's not getting better, normally when we get sick, when something goes wrong, the body heals itself. If it's not healing itself, then there's a possibility of an ongoing disease process that's not healing itself, and cancer is one of those. So these unexplained aches, pains, and persistent features, especially if it's persistent. New blood clots are another possibility, deep venous thrombosis. Bone pain, yeah, that can be a feature of possible blood type cancers. So most times you get these features, it won't be a cancer, but don't ignore it, because the time you ignore it, it could be, or the time you ignore it in a friend, in a family member, it could be. Get it checked out, and the vast majority of times you can be reassured that it's not a cancer and go and live the rest of your life as normal. On the odd occasion that it is a cancer, then treatment is so much more likely to be effective if it's early.